All right, let's go over 5 high-yield NCLEX medications that they love to test on. I'm gonna tell you exactly what you need to know. More, no less, no fluff. Let's go. Make sure you save and tag a nursing buddy. The first one is methotrexate. This is a chemo/immunosuppressant. They use this for cancers, rheumatoid arthritis, and psoriasis. It blocks the folic acid metabolism, which means it slows the cell growth. But the major risk for this is your bone marrow suppression, which is also low WBCs and platelets. It also can cause hepatotoxicity. If they are pregnant, they can never take methotrexate. Nursing interventions for this one. Monitor your CBCs and your liver enzyme. Avoid alcohol. This increases the risk of liver damage. You have to teach infection control because these patients that are on methotrexate are immunocompromised. Also need to supplement with folic acid, reduce the side effects. Just a little memory trick. Methotrexate equals methotoxate. Toxic to bone marrow, liver, and pregnancy. That's what you need to know for the NCLEX on methotrexate. Number 2, amutadrone. This is an antiarrhythmic. Use for this is it helps with life-threatening arrhythmias, such as VFib and VTAC. What it does is it slows down that electrical conduction in the heart. But a major risk for this is pulmonary fibrosis, which is cough, dyspnea, also can throw off the thyroid, have thyroid dysfunction, which can be hyper or hypo, can cause liver damage, photosensitivity. Your nursing interventions has gotta be, you gotta monitor your lung sounds, liver function, your thyroid labs. You need to know what their baseline chest X-ray looks like. Plus they need a pulmonary function test. You need to teach them to use sunscreen and report if they start having any coughing or difficulty breathing. They need to report that immediately. Little memory trick for this. AMEO equals airway plus arrhythmia, which means watch for lungs, liver, thyroid. Third medication, atorvastatin. This is your cholesterol lowering statin. It's used for high cholesterol to prevent heart disease. What it does is it blocks the cholesterol synthesis in the liver. But the major risk is liver damage. Also, rhabdomyolysis is where the muscle breaks down. You have your dark urine and it's painful. Nursing interventions are going to be take it at night. Most of your cholesterol is actually made while you were sleeping. You have to avoid grapefruit juice because it can cause a major toxicity. Statins in grapefruit is a no-no. Report any muscle weakness or pain because you gotta monitor for that rhabdomyolysis. A memory trick for this one. Statins save the heart, but they strain the liver and the muscles. Fourth medication, omeprazole or Xanax or benzodiazepine. This is a psych med. This treats anxiety and panic attacks. What it does is it inhibits GABA, can equal a calming and a sedative effect. But the major risk in that is CNS depression. Can also cause respiratory depression, dependency, and withdrawal if it is stopped suddenly. Nursing interventions are going to be teach them that this is short-term only. You need to taper off gradually. They need to avoid alcohol. They need to avoid opioids, to avoid driving until effects of this medication on them, they know. You're gonna monitor for drowsiness, confusion, and respiratory rate. Memory trick for this, alprazolam equals always, pause, relax, and Z's. All right, the fifth medication, ketorolac, which is also Toradol, NSAID medication. It's a pain reliever used for short-term treatment. It treats moderate to severe pain. Usually post-op with like a kidney stone. The action blocks the prostaglandin, which then in return will decrease the pain and the inflammation. But the risk with that, just like all other NSAIDs, is GI bleeding, ulcers, renal toxicity, and bleeding risk. Your nursery interventions are going to use this a max of 5 days only. Monitor your creatinine, your bun. Check for blood in the stool. Avoid it with other NSAIDs or anticoagulant. Little memory trick for this one. Ketorolac kills pain fast, but not for long. All 5 of these are high-yield medications that you can see on your NCLEX. Just don't remember the names. Know the side effects, the labs to monitor, the teaching points. That's how you will get the question right every time. Hope this helps. My study notes at the top of my page if you want more. Make sure you save, share this at, or tag a nursing buddy that needs help too. Happy studying!